Okay, so bonjour, mon nom est Guillaume Bourque. Je suis at McGill University. Oops, it's moving by itself. I'm going to do the presentation in English, but feel free to ask questions in French at the end if you'd like. So thank you very much for the opportunity to present this. So me and Tara are quite excited to be able to talk about the project that we started called COVID-19 Resources Canada. I really want to start by acknowledging the team of volunteers that's behind this project. Just to give you a bit of background, we started this a little over a month ago with basically a tweet where I was interested on my side at trying to see whether there was, I was seeing all of the emails flying around of people looking for reagents for testing and for various COVID projects, and I was curious to know if somebody was setting up a better way of actually tracking these requests. And this is how I started to connect with Tara and with the whole group actually. And then the next weekend we had our first meeting to start discussing this, and Tara will tell a little bit more about her side of the story. But the key point that I really wanted to highlight is that just spontaneously like this, we just gathered a group of volunteers. You can see it really ranges from students to people doing web development and really an array of people who basically just wanted to help. So this is how our project started, and we've been meeting since then via Zoom and using Slack pretty much every day actually since then. I'd also like to acknowledge our sponsors and partners that have, along the way really sort of supported us and providing some resources to help us really put this together. So a bit more about the project and what we're trying to do. So I mentioned the example of thinking about information about reagents. What we really wanted to do is we could see all of this information flying around, and we wanted to be a reliable source of information and expertise. So we wanted to be a sort of a one-stop shop to try to gather some of that information and avoid duplication and just facilitate things. So the objective, looking at the second point, was really to try to support and facilitate the coordination of some of the research efforts. And perhaps Tara will talk about this later, but it's very much aligned with the objectives of CanCOVID. So this is also why we're very happy to be working together, and it's quite complementary from our perspective. So the third objective is really to support capacity building in public health research, but also grassroots initiatives. And as you'll hear from Tara, this is really was our starting point when we started with this. So I'll just give you a quick overview of some of the platforms. So mainly this is really a website that we've been building, and the idea of the website is really to try as much as possible not to replicate other things, but to aggregate resources and information as much as possible. So if you look at the top left, you have a volunteer database, and Tara will give more information about that. And I'll just now talk a bit about some of the other components. Some of the other, one of the components, and this was actually our first collaboration really with CanCOVID, was the idea of actually start collecting funding opportunities. So we could see, and it's great to see that there were so many funding opportunities, emergency funding opportunities that were appearing left and right. And so we felt like we needed an easy mechanism to pull that information together in one place and sort of crowdsource the ability for people to actually add additional opportunity. So you see that there's a button where you can directly, if your organization is whether it's a local opportunity or a regional opportunity or a national opportunity, you can submit suggestions that way. moving on to another component of the website, we also wanted to aggregate some of the funded projects, again, as a way of just helping people find each other, find relevant projects that have been funded that might be relevant to their own project. Using again the same type of strategy of starting up by aggregating some of the data, but then have the ability for anybody to directly submit projects. And Fatima, who's also on the Zoom chat, has been instrumental in curating some of these sections. I started with this example. This is another, I think, important component of the website. This was developed in collaboration with Simon Foote at the NRC, and this reagent database. Again, that was my entry point into this, but the idea here was to actually facilitate people finding relevant reagent, whether it's because you're looking for something specifically for a COVID project, or whether it's something that you actually have to offer to others. We wanted to create this type of marketplace just to help people find each other. This is my last slide before I pass it on to Tara. But the last thing is, this is something that we're currently working on. We'd like to be adding a section on the portal that's really about expertise. So having a list of experts in Canada to really be listed on this. There's a lot of institutional similar database, and we're currently working on aggregating some of these databases to really have a national repository of expertise. So this is something that we're working on. If you have suggestions or idea, we'll get back to that, but you can also contact us. So at this point, I'll pass it to Tara, who's gonna describe a little bit more on the volunteer database. So Tara, I think you're on mute, and I don't know how to.
Of course. Okay, so Guillaume, I'm going to be asking you to advance slides for me.
Yes.
Okay, so all right, actually, and I don't remember if Guillaume had said this, but to sort of explain a little bit of background, Guillaume is the director for bioinformatics at the McGill Genome Center, which is partly how he came into this, with a lot of experience with dealing with organizing large amounts of information and website development and developing ways for people to interact with them. The way I came into this is that I'm an infectious disease researcher at the University of Toronto. I don't work on COVID-19, I work on Lyme disease and the biophysics of how bacteria interact with blood vessels. But one of the things I had realized, because I had been following this for a long time, was that one of the early features of the responses to COVID-19 in Germany and South Korea was massive mobilization of researchers and scientists and innovators to come up with ways to address this problem. And I, possibly due to my ignorance or due to other factors, but I wasn't seeing the kind of scale of mobilization of the scientific workforce in the early days of COVID-19 that I would have thought would be a good idea. And so because I knew what was coming, I started organizing to shut my lab down or move it offline before the University of Toronto shut. And then I had a little bit of time then when I could think about this, and I was thinking that I still wasn't seeing a lot of public mobilization. And so I guess about a week after most Canadian universities shut their research buildings, I got up one morning and I thought, you know what, I don't see anything yet. We need to start signing people up in case people need to help with diagnostics or other processes. And that was it. So I don't have technical skills. So I got my brother out of bed in BC early in the morning, asked him to set up a sign-up form. And for scientists and researchers who might want to volunteer to help with the COVID-19 response. and we set it up by a Friday afternoon. And then the thousands of people who signed up almost immediately was absolutely extraordinary. And that was how I met Guillaume, and how by the Saturday morning, we all started working together. Now about 20 of us that have been building this website. So a lot of my efforts have been focused on helping get scientists and people with technical skills and researchers to help other organizations to help their response, in addition to potentially connecting them with research projects. So to date, we have, actually, we've probably nearly crossed the 4,000 mark as of today. We have people signed up in all provinces and territories except Nunavut. And we have an interactive map on our website now. This shows the numbers within provinces, but you can zoom in and see all the different places that people are living who have signed to help. And we have recently, in the last week, brought on regional leads in every province and region to help us to find and post region-specific content and identify and try to respond to region-specific needs related to COVID-19. Scientists can assist. Guillaume, would you mind forwarding? Okay, so some of the types of requests that we're getting to date have been in, so we have people who come to us looking to find people that they can hire, as well as volunteers. A lot of these have been very informal to date, but we're starting to scale up more. So for example, people contact us to find staff for diagnostic testing, for support with web development, analytics, communication support for other grassroots initiatives that have sprung up very quickly. Request to get us to help share information and post it from other organizations that are staffed by scientists and others. Contact tracing, helping with staffing and finding emergency placements for staff in nursing and seniors homes, everything from cooks to physicians, as well as the needs of food banks and shelters. But I wanted to point out, and I want everyone here to know, that we actually have a database of volunteers or people who perhaps could be hired or collaborate who have some extremely specialized skills. So we have a sign-up sheet that asks a lot of detailed questions about technical skills. So for example, in our database of approximately 4,000, we have 105 volunteers who have biosafety CL3 or CL4 training. We have about 1,700 with data analytics skills. We have 2,414 people who speak languages in addition to English. Approximately 700 of those are French, and the others are all kinds of different languages. 83% of our volunteers are at a stage where they have complete a BSc or a bachelor's degree of some type. And of these, 72%, or sorry, of the whole database, 72% have at least a master's or a health professional degree or higher. Guillaume, would you mind advancing? So some of the professions, this isn't all of the questions we asked, but these are sample of some of the people who are in our database. So we have 1,600 grad students, most of them PhD. We have about 600 undergrads. We've got about 200 health professional students, a chunk of lab managers, some physicians, quite a few postdocs, about 300, 250. We have principal investigators who've signed up from the beginning to volunteer. We have lab technicians, and we have professionals, and this can include many people who, for example, might work in mining or fisheries or other parts of the national and provincial governments, as well as people who have, web development or other skills that aren't explicitly scientific. Lots of engineers as well. Guillaume, would you mind advancing? Some of the languages that people speak in addition to English. So we have a category called Other, which is everything that's not included on this graph that you can see. We have about 600 French speakers, and we have lots of people who speak Mandarin, Spanish, Punjabi, Arabic, Cantonese, a whole series of languages, and we collect a lot of information about this because initially one of our ideas was that it's important to be able to have scientists or people with expertise go out and do interviews and talk to people in communities to help correct and present clear information. And because of the multilingual nature of many people in the sciences, we actually have a lot of capacity to work in multiple languages that could be useful for public health. Guillaume, would you mind advancing? And then this is just a sample of some of the volunteers' technical skills. So we have, bioinformatics. We've got an absolute ton of people who can do PCR. There's vaccine development. There's RNA virus work, fabrication from the engineering point of view, experience with liquid handlers. You can see we were thinking about diagnostics when we set this up. But we collect a lot of information about different technical skills that might be useful and that might be useful to researchers in this group who might be looking to find people in their region, because we know where everyone lives and we can geolocate them based on their postal code. We know who might be around, who might be able to help with projects. Guillaume, would you mind forwarding? So if there is anyone who would like to volunteer or would like to pass on information about how to volunteer, people can join our database by going to the volunteer initiatives and clicking on the Volunteer Now green button. And this is generally for researchers, senior graduate students, typically medical and allied healthcare professionals. And then if you want to request volunteers who could work on your project, perhaps for the summer or just in any kind of way at this point, you can click on the green request volunteers button, and there is a form that pops up that you fill out with the details of what you would need, and then it feeds into our database, and we have a series of people who process those requests and help enroll people who might be interested in what you are looking for, and who opt in and say that they're willing to share their CV and other information with you. And then we provide basically an Excel sheet with a list of the information about every person and their CV, and then it's up to you to go from there. And that is it. So Guillaume, if you would like to go to the last slide. Oh, you're muted.
So I'm on the last slide now, right? So this is the end of our presentation, right? So at this point, we really would like to turn it over to question, but also specifically ask the group, what we should be doing next in terms of helping as well was really what we were curious to hear. But we're obviously happy to answer any questions that you might have at this point.
And so you can go ahead and either raise your hand or you can put your message in the chat bar. And Fatima has a question.
Well, hi everybody, this is Fatima. I work with Guillaume and Tara. I just wanted to bring your attention to the chat box. I put a link to a Google Doc, and we would appreciate if you come up with questions or suggestions that we can improve our platform to help you better, to capture your needs better. Use that Google Doc. It doesn't have to be right now, but over the weekend, whatever. We would be grateful for your feedback and input. The link is in the Zoom chatting, and I will post it on CanCOVID's Slack channel as well.
Thank you, Fatima.
Yes, we would very much like to know about what major barriers are that people are experiencing and whether these are things that we can help with. And we'll probably try to set up a series of surveys as well once we get more feedback.
So Pillay has a question.
Yes, I come from a non-medical background. I'm a professor in engineering at Concordia. And it turns out that there are some inventions and innovations going on in engineering on killing bacteria with magnetic fields. And it's an area that I work in, is the design of magnetic fields for electrical machines. But it's very different from anything else that I've seen that's going on here. And there might be the possibility of even eliminating such a virus while it's in the body, similar like to an MRI. Does anyone know how I could link up with someone or who may be interested in funding some sort of research in this area?
Guillaume, I mean, we can, so certainly you could post in the Slack community, but Guillaume, maybe you can talk about the unfunded or the research projects part of the website and
Yeah,
what we
well,
want to do for precise reason.
yeah, so I would have said in the current, given the current infrastructure that we have, actually the CanCOVID Slack is probably the best place to post these types of suggestion and requests. But this is something that, again, there's the platform and the website that we've developed, which is in some ways really we view that as some kind of a summary of some of the information that maybe is uh, that people would want to see in terms of actually having discussions for collaboration. I think this is really the role that CanCOVID platform is playing, and I would say that that's probably the best place to post these types of requests. As Tara mentioned, and maybe this is again a question for the group, one of the questions that we were wondering is whether just like we are currently posting on the website funded projects, we were wondering whether there would be interest in actually having a more systematic portal where people can start posting some of their ideas or some of, more explicitly the types of collaboration that they're looking for. Whether people would want to have that, in a public-facing website, or this is better suited for the CanCOVID platform is actually, I think, one of the questions that we were thinking of asking as part of a survey that we're developing. And so I don't know if people have an opinion on that.
If they do have an opinion, could they share it via the Google Doc link that Fatima put up earlier that's in the chat box? Yeah. Perfect. So Stanley Lee asks, how are you? Oh, pardon?
Oh, sorry. I was also going to say we're also dropping that in Slack because for those who can't select and copy links within Zoom chat, we're going to drop those links in Slack as well.
So another good reason to visit the CanCOVID Slack. Thank you. So Stanley Lee asks, how are you supporting local health authorities with reagents and test kit supplies?
So this is a very good. So this is a very good question. I should say that the reagent module as part of our website is one of the most recent addition, and we haven't started really activating it in some ways but this is something that we would like to do, but we haven't started, receiving requests on that front, but that would be great.
Levon?
What I would say is,
go ahead.
Sorry, I was actually going to say one of the early requests that we had was for help with organizations and grassroots organizations that were trying to collect PPE for healthcare and for helping to coordinate going out to find reagents that might be available in university labs. So on the PPE front, a lot of that has sort of settled or consolidated, so we didn't need to provide help. There were other people doing that. And then on the reagents, in terms of sharing reagents with public health authority or local health authorities, we're very integrated with local health authorities and with national health authorities through connections with the NML and PHAC. But a lot of that is being facilitated and organized by the universities because they have the infrastructure to do it.
Wonderful, thank you. We have just a few more minutes if anybody has any questions that they'd like to raise their hand or put in the chat box. I was going to share that Levon, pardon me if I don't say this correctly, Abrahamian from the University of Montreal commented that he believes one of the outcomes of this initiative could be the consolidations of the teams for group grant applications. So some nice forward thinking, what is next steps. If no one else has a question, I have one, which is just about the distinction between the CanCOVID platform. Guillaume touched on it briefly, but how do you see, for somebody who's inundated with all of the information and the resources that are out there, how do you navigate which spaces for what thing?
Yeah, so that's the way, like one of the examples of collaboration between CanCOVID and our portal is, if you look in CanCOVID, there's a channel for funding opportunities. And so it's great that people post example of funding opportunities there that as they see them. And we now monitor that channel and use those to add to the list that is then displayed on the website. And the idea is really to work together in that way, such that there's really, to me, a need sometimes to summarize information and have just a one easy place to see that. I see that Vincent has a question. Maybe Vincent, if you want to ask.
Yes, thank you. It's first a comment. I think what you have achieved here, Tara, Guillaume, and the team here is spectacular and extremely needed. So thank you. Just thank you. The second thing is, how does that relate to other initiatives of this type of nature in other countries? Of course, the challenge we are facing is so big now that only international collaborations will probably help address some of these challenges. So do other countries have similar initiatives, and how are they linked with yours?
So maybe I can start and you can complete, Tara. It's an excellent question and not something that we've looked at too much, I would say, yet. There are examples, for instance, in terms of, we have as part of the website a list of initiatives, other initiatives, which are really a collection of resources and things of that sort. And some of those are international initiatives. And there are efforts, and Mark Leggett from Research Data Canada, for instance, has started to build a map that actually tries to organize all of these resources, both in Canada, and this is then connected to all of the similar resources across the world. So I think, I mean, it's a very good question and something that we haven't started to explore, I guess, too deeply, but that we probably should going forward to see if we can further link up now that we are basically organized within Canada with some of this information to see if we can start reaching out further. Very good question.
And I think oh, so sorry, I didn't mean to.
Oh, I was actually saying that early on, I mean, certainly from the volunteer point of view, one of the first people we spoke with was someone who was doing something similar in the US and had very quickly been completely overwhelmed by the number of people. And so we were able to learn from that. But speaking for myself, not for Guillaume and maybe others, where I started out really paying attention internationally, I found that the massive quantities of information and the urgent need of coordinating more locally and within Canada forced me over the last month to really try to become a specialist within Canada instead of so that we could get the work done. And this is unusual for me. I normally pay more attention outside, but it's been so hard to figure out processes that work without overwhelming everyone to collect this, that I think that that's what we've been spending most of the month doing, is figuring out how to do this without people burning out and while still being effective. And the most important priority has been Canada first, at least for now.
Thanks, Tara. One final question. Is there, from Guillaume Lesage, is there any plan to list requests for equipment sharing?
Very good question. We were discussing that at our daily meeting today. So this absolutely. So this is something where we've heard this from a few people and are considering expanding the Reagent database to potentially also include equipment. But one thing that is helpful, again, in guiding these decisions is to hopefully hear from the community on these things and whether there's interest and buy-in. But absolutely. So it's good to hear that this indeed there's a need for that.
Well, that is fantastic. I want to thank Guillaume and Tara and everyone else for joining us today. Thank you so much. And please see us again. Our speaker series is continuing Tuesdays and Fridays at 4 p.m. Check the Slack for your Zoom link information, or you'll be receiving an email. Thank you so much, everyone.